To be able to provide mother's milk to all those needy infants is a divine venture. And wishing all the success to the partnering organizations of this magnanimous deed, let's begin today's formal event by welcoming our dignitaries onto the dais. May I take the privilege of welcoming our principal, Professor Vijayalata ma'am, to please come onto the dais. Madam, an able administrator and a dedicated researcher, she has recently joined as the principal of the college and she is adding a glory to the college. I request Srimati Prasanna Lakshmi Madam, member Sushena Foundation, to present a bouquet to our principal, Professor Vijayalata ma'am. I now request Dr. Santosh Kumar Kraleti Garu, Founder Director, Dhaatri Mother's Milk Bank, to please join us on the dais. I request Dr. Vijayalakshmi Madam, Head Department of Chemistry, Women's College, to extend a floral welcome to Sir. I deem it a privilege to welcome our special invitee of today's program, Mr. Alluri Ananta Venkata Rangaraju Garu, Managing Director, CEO, Nagarjuna Constructions Limited, to please join us on the dais. Mr. Raju Garu believes and his great values have been inculcated in his firm, which helped them strengthen their place in the league of large infrastructure and construction companies. He is listed in the 12 Indian companies, and we are immensely delighted to have a virtuous man amongst us today. I request Dr. Alia ma'am, Department of Chemistry, to extend a floral welcome to Seema ma'am. I now request our special invitee, Mr. Durga Prasad Garu, to please join us on the dais. Mr. A. Durga Prasad Garu is the advisor, Dhaatri Mother's Milk Bank. He is an accomplished executive with over 37 years experience in financial management and cost management in variety of industries. He has been a flag bearer and provided his all-round support to Dhaatri project.
शुभं करोति कल्याणं आरोग्यं धनसम्पदः शुभं करोति कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिर्विनाशायां दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते शुभं करोति कल्याणं आरोग्यं धनसम्पदः दीपज्योतिर्परब्रह्मा दीपज्योतिर्जनार्दनः दीपेन शाश्वते सर्वं श्रद्धादीपनमोऽस्तुते शुभं करोति कल्याणं आरोग्यं धनसम्पदः शत्रुबुद्धिर्विनाशायां दीपज्योतिर्नमोऽस्तुते दीपज्योतिर्नमोऽस्तुते असतो मा सद्गमय तमसो ज्योतिर्गमय मृत्योर्मामृतङ्गमय असतो मा सद्गमय तमसो ज्योतिर्गमय मृत्योर्मामृतङ्गमय.
Karuna Vaketi Garu, who has joined us. Ma'am, a hearty welcome on behalf of the entire gathering here. I request Dr. Santosh Lakshmi, Head Department of Food and Nutrition, to extend a floral welcome to Madam. Madam is a senior IAS officer and a dynamic bureaucrat, and she is presently the Commissioner of Family and Health Welfare. She held various challenging administrative roles in her career. She was chosen as the Mission Director for the Land Survey Program in 2017 by the Telangana government, knowing her abilities and strengths in getting things done. We are extremely honored to have this dynamic lady amidst us today. Thank you so much for joining us, ma'am.
Students, good morning. Thank you. So it's a privilege and honor to be part of this program as Principal Women's College. I feel so honored to be here for this noble cause which has been done by Dhaatri Foundation and Sushena Foundation. So I welcome our Chief Guest Srimati 𝐾𝐡𝐚𝐚𝐭𝐫𝐢, IAS Commission of Family and Health Welfare. Special invitee Sri Alluri Anantha Venkata Rangaraju Garu, Managing Director, CEO, NCC, and Mrs. Seema Pavaskar, CSR Head, Compton Greaves, Miss Dr. A. Durga Prasad Garu, Advisor, Dhaatri Mother's Milk Bank and CLMC, and Dr. Srinivas Murki, President, Sushena Health Foundation, and Dr. Santosh Kumar, Founder Director, Dhaatri Mother Milk Bank, General Secretary, Sushena Health Foundation, and Dr. Subbaraj Garu. I welcome you all to this college, sir. This University College for Women is a constituent college of Osmania University with autonomous status since 1989. It is accredited with A grade by NAC and also has a CPE status, that is College with Potential for Excellence. And it has been established in the year 1924, and the college has strived for 93 years to empower women and achieve their goals. And I am confident that with this each year passing by, the college will rise the new heights and excellences, and the college will help the underprivileged and the students who are from rural background to come and study in this college and have an excellent exposure towards the education and move ahead with power of knowledge, character and confidence. Thank you very much.
I now request Dr. Santosh Kumar Kraleti Garu, Founder Director, Dhaatri Mother's Milk Bank, to make his opening remarks.
A very good morning to all the young and energetic future women power of Hyderabad, Telangana and India. A big round of applause for all the women who are here. And we have some of the ideologues and women achievers and who have been leaders in motherhood and also leaders in women welfare amongst us. And very privileged and honored to have 𝐾𝐡𝐚𝐚𝐭𝐫𝐢 Madam, who is the Commissioner of Health and Welfare, Family Welfare, here amongst us. In 2016, when we were working in an organization which was an international organization, we were talking about hand hygiene compliance, breastfeeding compliance, and such quality improvement initiatives. And we saw that sometimes there are gaps for which we do audits, but those gaps have to be met actually on ground. అప్పుడు మేము గమనించింది ఏంటి అని అంటే, మనము తల్లిపాలు తాగాలి, చేతులు కడుక్కోవాలి అని చెప్తూ ఉంటాం, కానీ చిన్నవి అప్పుడప్పుడు చేతులు కడుక్కోవడానికి అప్పుడప్పుడు వాటర్ ట్యాంక్లో వాటర్ ఉండదు, వాష్ బేసిన్ ఉండదు, ఇట్లాంటివి అవ్వచ్చు. సో ఇలాంటివి మన గ్రౌండ్ లెవెల్లో వచ్చి పనిచేయాలి అని చెప్పి 2016లో డాక్టర్ సత్యనారాయణ, డాక్టర్ శ్రీనివాస్ గౌడ్, myself, under the able guidance of Dr. Sudarshan Reddy sir, late Sudarshan Reddy sir, who's there with us here from the heaven, who's looking, and also with the guidance of Dr. Srinivas Murki sir, we started this foundation called Sushena Health Foundation. All three of us, we quit our jobs in 2016, and in 2017 we registered this as a society and we started working. ఆ రోజు 2017లో ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ నిలోఫర్ హాస్పిటల్లో స్టార్ట్ చేసినప్పుడు Karuna Vakati madam had supported us immensely in that inauguration and she actually moved every stone and made it a grand success. Thank you, madam. And we know it was such a grand success, and it would not have been a grand success without the support of ma'am and also government of Telangana and Nilofer Hospital. Alage, Iroju, this is also a very historical day that we are having a Sangam of Ganga Yamuna Saraswati. On one side, NGO and doctors who are working in this area. On another side, education institutions who are looking after education how exactly and best we can match industry, jobs, and then the education. And on the third front, we have huge confluence by Antarvahini, which is not seen. పని చేస్తారు కానీ అసలు కనబడరు బయటికి. అట్లాంటి ఇండస్ట్రీలో నుంచి మనకి సిఎస్ఆర్ హెల్ప్ చేసే రంగరాజ్ గారు అండ్ సీమా పవాస్కర్ గారు, దుర్గాప్రసాద్ గారు, సుబ్బరాజ్ గారు, దే ఆర్ హెల్పింగ్ అస్ బట్ నెవర్ ఆన్ ద స్క్రీన్. చాలా మనం పూర్వం మనం ఈ చేయితో దానం ఇస్తే ఈ చేయికి తెలీదు అన్నట్టుగా ఆ విధంగా ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ని సుమారుగా లాస్ట్ 5 years బట్టి ప్రతి సంవత్సరం మనకి సుమారుగా 30-35 లక్షల వరకు ఖర్చు అవుతున్న దాన్ని ఎంతోమంది ఇలాగ దానం ఇస్తున్న వల్లే అది ముందరికి వెళ్తోంది. అండ్ వీ థ్యాంక్ యూ ఆల్ ది సిఎస్ఆర్ డోనర్స్. వీటన్నిటితో పాటు వీ హ్యావ్ ఇమ్మెన్స్ support and blessings from government of Telangana who has been supporting this endeavor. And of course madam will talk about how this initiative is going to be taken forward. But from Sushena's point of view and the Dhaatri Mothers Milk Bank point of view, మేము చాలా అదృష్టవంతులము. ఎందుకంటే ఇలాంటి ఒక అమోఘమైన ఈ సంగమం ఏదైతే జరుగుతుందో ఆ సంగమంలో వీఆర్ జస్ట్ విట్నెసింగ్ హౌ బ్యూటిఫుల్లీ థింగ్స్ ఆర్ ట్రాన్స్ఫార్మింగ్ అండ్ హౌ హెల్త్ కేర్ ఇస్ బీయింగ్ ట్రాన్స్ఫార్మ్డ్ in this current situation. So with the support of all the people, blessings of all the good-hearted people, this whole program is going forward. And in this initiative, we welcome each and everyone to join hands, each and everyone to come together. Talli paalu muddu dabba paalu vaddu అన్న స్లోగన్తో మనం ముందరికి వెళ్తున్నాము. అలాగే ఈ తల్లిపాలు ముద్దు డబ్బా పాలు వద్దుతో పాటు ఇంకొక అద్భుతమైన ప్రోగ్రాం కూడా ఇక్కడ స్టార్ట్ అవుతోంది. అదే మన ముందర డాక్టర్ అనుపమ మేడం ఇప్పుడే వచ్చారు. ఐ జస్ట్ కెనాట్ స్టాప్ మైసెల్ఫ్ ఫ్రమ్ మెన్షనింగ్ హర్. ఆర్య జనని ఫస్ట్ 1000 days ఆఫ్ లైఫ్ ఎలా అయితే ప్రహ్లాదుడు అలాగే అనేక మంది గొప్ప గొప్ప వాళ్ళు కడుపులో ఉన్నప్పుడే మంచి మంచి విషయాలు ఎలా విని గొప్ప జన్మం పొందారో అట్లా హౌ ఎపిజెనెటిక్స్ కెన్ ప్లే రోల్, హౌ సమ్ జీన్స్ కెన్ యాక్చువల్లీ be activated if you are talking good, if you are doing good, and if your karma is good during that very very pious 9 months and also before and after. అలాంటి గొప్ప ఆరిజినరీ ప్రోగ్రామ్ డిజైన్ చేస్తున్నారు డాక్టర్ అనుపమ రెడ్డి మ్యామ్, హూ ఇస్ హియర్ వర్కింగ్ విత్ ఆర్కేమట్. అండ్ సో దిస్ ఇస్ సచ్ ఎ గ్రేట్ confluence and time in this whole epoch, and we are blessed to be in this, and we are very very happy to work with Government Women's College, which has been seat for research, and a very good team of Department of Food and Nutrition and Department of Chemistry who have come forward for doing very very good research projects in mother's milk. Thank you very much, and wishing everyone and all of us good motherhood and success.
I request Vijulata ma'am and Dr. Santosh Garu to please go ahead with the MOU signing. I also request Dr. Srinivas Murthy sir to please join in this event. I request all of you to please give a bigger round of applause for the great cause. All the dignitaries on the dais are requested to please bless us in this great venture. With your great round of applause. With a great hope that the tremendous power of Women's College and the great humanitarian service of DMMB will take this forward and get good results in the long run. Thank you so much.
I think it's a very big event for us as 𝐶𝐚𝐚. 𝐶𝐚𝐚 Health Foundation is an NGO type of organization. We are a group of people committed to the cause of maternal and neonatal health and child health. So we all started, as Santosh has said, 5 years back, thinking of what we can do apart from our regular career, what else we can do to improve the health of newborns initially. And then we started thinking that newborn health is good only when maternal health is part of the newborn health. So then 𝐶𝐚𝐚 came into forward, and then we are starting to think of how we can help the mother and newborn and the child together. And in this process, we first started the Mother's Milk Bank in Nilofer Hospital. That is the first NGO-based milk bank in Telangana, and it's the largest milk bank. Every day, we collect an average of 5 liters of milk from the mothers. And this milk goes to nearly 100 newborn babies who are admitted to the NICUs of Nilofer Hospital. So the milk is collected from the mothers who have excess milk, and that milk goes to the premature babies or small low birth weight babies. And this milk is immensely useful for the small babies because it will help them to grow, it will help them to prevent infections, and help them to go home early. So these are the pillars of growth of these small babies, and that foundation is laid by Mother's Milk, which is a donated milk from other mothers. And this Dhaatri Milk Bank, what it does is it collects the milk from healthy donors, pasteurizes the milk, and gives to the needy babies. So it's almost very similar to blood bank, but the services offered by Mother's Milk Bank is maybe 10 times more than that by the blood. Now when we saw this immense success, when we saw a lot of mothers are benefiting and mothers of babies are benefiting, then we realized that Mother's Milk Bank helps not only in providing milk, but also helps in promoting breastfeeding. Because all the mothers who come there, they are helped in helping breastfeeding their babies, in curing lactation related problems, and also when they come there, they have the feeling that apart from helping their own babies, they need to help the other babies who are not having, whose mothers are not having adequate milk. So this helped us to develop not only milk bank, but other aspects of breastfeeding, kangaroo mother care, and other skin to skin contact, and family centered care or a mother centered care is what we learned from this milk bank project. And with that success, we got offers from other states to help them. We did help establishing milk bank in Indore and Bhopal, and that has been a success. We have trained the nurses or the milk bank staff there to conduct the milk banks in a more protocolized manner. Then after that, we are getting a lot of inquiries and a lot of requests to support or start milk banks in other parts of Telangana and also neighboring states. Very soon we are going to start a milk bank in Kakinada Medical College, and almost the work is on the process. So one aspect has been milk bank. Then we realized that we need to sustain the work, and to help us sustain the work, we have wonderful donors like Nagarjuna Constructions, Crompton, NDTT, and other people. Voluntarily they are coming and supporting. Some of the mothers who come to donate milk, they start donating money also and start supporting services also. They are doing voluntary services in Nilofer Hospital to help the babies and the mothers. So this is a positive thing that when they are coming to do something else, they are doing more good to the babies and the mothers. So that has been the first goal, and we have achieved that. And we are hoping that with the onset of, or with the inauguration of today's ambulance-based milk bank. So what is this milk bank ambulance? it is an added advantage to what we have in Nilofer. So what we do in Nilofer is we collect the milk, we pasteurize, we ensure that there is no infection in that milk and give to the babies who desire. Now we know that many mothers are willing to donate, but they are not able to come to Nilofer. So how do we get that milk? So one method is by having the milk bank or ambulance-based milk bank. Our ambulance will go to the mother, collect the milk, pasteurize and give it to the babies. The other method is, lot of babies in city of Hyderabad are not able to get mother's milk when they are in the SNCUs or in the NICUs. So we need to link up with these NICUs as SNCUs where they are giving formula milk, and we want to replace all the formula milk with mother's milk. And that's our objective, and we hope that this ambulance is going to help us replace the formula milk with human milk in all the NICUs or the neonatal intensive care units of Hyderabad. And in that goal, we request Madam Karuna Vakati Madam, because her heart is also in breastfeeding and nutrition of babies and infants. We request you to help us utilize the services equally in the government sector or more in the government sector too. And we are there, ma'am, to help as much as possible to support all the SNCUs in the state of Telangana. So one has been the milk bank, and then the milk ambulance came into picture. Then the other thing which we have started is we started a conference. Every year we are going to do a conference, the first South Asia conference, which focuses on milk, mother's health and preterm nutrition. So this we are going to do it in the month of November, and here we already have the world support, world leaders who are doing immense work on nutrition and preterm nutrition are part of the faculty, and that conference is going to be organized in Hyderabad. So I request all of you to ensure that be part of that conference. It's both a hybrid conference, a virtual and physical conference. All the students who are here, part of nutrition program, can learn a lot about mother's health, mother's nutrition and baby nutrition from this conference. And this conference is also going to help us to gain some resources in running our milk banks. The third aspect has been steered and led by our dynamic leader, Dr. Anupama Reddy. She does voluntary service at Ramakrishna Math Hospital, and we already knew that she was doing this work on 𝐼𝐴𝐺𝐻, which is improving the fetal health. When you improve the fetal health, by improving the maternal health, you will get better babies, you will get better mothers. Lot of problems of mothers can be solved just by counseling, just by nutrition, and also by taking care of mother's health. And that is the goal of 𝐼𝐴𝐺𝐻, to ensure that mothers go through pregnancy in a pleasant and a happy manner so that they deliver happy babies. So we want to reach the entire mother, newborn and child segment, and as we do more good, we desire more, and in that desire, maybe very soon, we will be planning to come out with a mother and child hospital. We got the donor support for, we got 1,000 yards at Kasturba Memorial Trust in Langar House. So, and that's going to be a trust hospital free of service for all the pregnant women and the children and newborns. And as we do more work, more donor support is coming, and our shoulders are becoming big. But we hope that with all the support, we'll be able to do this good job. Thank you.
See, already in our prayer song, we have actually said Mrityorma Amrutangamaya, and that Amrutam is the mother's milk. And this is what Dhaatri is providing to these needy newborns, especially the preterm newborns, who are all separated from their mothers, unfortunately. And this is the need of their health. And this is when they will survive. Without mother's milk, they are going to go into a lot of complications. And this is the idea behind establishing Dhaatri. So this is what Dhaatri does day to day. Apart from actually providing milk to the preterm babies, as Dr. Murki said, this is the Dhaatri Milk Bank actually encourages mothers to feed their own babies. So this is, they help in, we do help in solving a lot of day-to-day breastfeeding issues, lactation problems. So they help. So only if after the mothers have given the milk to their own babies, the extra milk is donated, which is carefully screened for all the diseases that could be transmitted. Only when the screening is negative, we take the milk. It is carefully stored and sterilized for future use. So far, in the last 5 years of operation, or 4 years of operation, I'm proud to tell actually, we have up to 31st of March. Okay. Up to 31st of March, more than 9,000 mothers actually have donated milk, and they have given about nearly 2,000 liters of milk has been donated to the milk bank, and we have given 1,200 liters of milk to the needy babies, and 10,000 babies have been touched so far. So I think this is what we have done. So we have actually saved the lives of 10,000 babies in the last 4 years. And this is in the all in the premises of Nilofer Hospital. So I think last but not the least, I would like to really thank first of all the Nilofer Hospital for providing us the space for doing this excellent work. I would say this is a God's work, and I would like all our donors here who are on the dais and off the dais. Actually, there are many other donors. Thank you so much for supporting us. So I would really like to, as Dr. Murki said, we want more and more encouragement, more and more people who voluntarily who can encourage other mothers to donate milk. That is more important. And I've got a message from Dr. Chandramouli Garu here. Mothers, mothers and would-be mothers, encourage one mother to feed the baby. I think one mother can encourage actually one mother. I think this will be really great. The word spreads, and then I think this will be a great initiative. Yes, so they're all future mothers, future leaders, and so I think please keep this in mind. Breastfeeding is the best for the baby. It is actually godliness to actually feed your own baby and donate milk. Thank you so much.
Dr. Srinivas, President of the Sushena Foundation, and Dr. Santosh Kumar, General Secretary and also the Founder Director of Dhaatri, respected Principal of the University of Women's College, and today's Chief Commissioner of Healthcare and MD of NCC Limited, and Dr. Durga Prasad, past President of Institute of Cost and Accountants of India, and also an Independent Director of NCC Limited, and other dignitaries on the dais and off the dais. Today, it gives me an immense pleasure for inviting me and giving an opportunity to participate in this wonderful, greatest activity of providing mother's milk to the babies who are in need of that milk. Really, it gives me a surprise how the concept and activity taken up by these doctors. Really, we should also appreciate them for taking up this a difficult and important activity, providing human milk for the babies who are in need of that milk. Really, there is no alternate food for the babies except the mother milk. If there is any alternate food, there is no alternate food except to the mother's breastfeed milk. So those newly born babies who are in need of that milk, how to make them, how to provide to them. No hospital, no medical alternate is there to provide that best food. It is called as Amrutam. So bringing that milk and providing that milk to the needy babies, just months, days babies, months babies, how to, and saving the the babies, and already we know there is a highest death rate in India, these newly born babies. So recognizing that activity and moving and collecting the milk wherever the surplus milk is there from the mothers and providing that milk to the needy babies is really a great activity. We should hands up to those doctors and those people who are behind this trust, the foundation and this function. So I appreciate and thankful to Dr. Durga Prasad, who is working as an independent director. While allocating the funds of NCC CSR funds, he recommended for this good cause, noble cause, a donation to this institution. And I am personally thankful to our MD, Sri Rangaraj Garu, immediately donating the amount and to give a support to this institution. Accordingly, last year the company donated the amount, and current year also now donated for this special scheme today, what they are launching today. So we are there, NCC Limited is there, and it is NCC not only doing the business and also kept the social responsibility as an objective. And every year, our company is spending nearly 10 crores rupees on this social responsibility activities. You know that NCC, being a largest construction company, in the listed entities, after the L&T, doing the projects across the India, and NCC indirectly serving the nation by completing various projects. So not only keeping the objective of profit earning and the social responsibility also kept by the company. And our MD, ఆయన మామూలుగా మాట్లాడరు బట్ ఎక్కువ చేస్తారు. So he immediately responded for this one and donated the amount. So NCC Limited taken up various social responsibility activities like rural housing to the poor people and rural sanitation, and also adopted the schools, nearly 3 to 4 schools in and around the city, and we adopted those schools and providing the facilities to the poor people for the education. And also we have taken up a big project, construction of houses to the poor people. Nearly more than 100 people we provided the houses at a particular place in Andhra Pradesh. So they are all happy. So like that, NCC taken up various activities, and we have given the significant amount of donations to the recent Corona-19, to the Chief Minister Relief Fund to take up the relief measures. We have provided the ambulances for these COVID-19 victims. So like that, several activities the company has taken up. But among all those things, the activity what these doctors are doing is really appreciable, and the NCC certainly will support this activity whenever they need any funds for that activity. So we lastly appreciate the doctors, and also the today's activity of entering an MOU with the Women's College is a really good thing, and we are all happy in presence of all of us. We entered the MOU, so it has given a lot of happy. And lastly, I wish them and also pray the God to bless them to take the activity forward, to provide milk to more and more these needy babies, to save their lives, and it gives for their growth. There is no food, and what the immunity what it gives, no other food gives that type of immunity for growth and to the healthy of those babies. Thank you very much.
Thank you very much for giving Crompton an opportunity to serve the community in need. As a corporate citizen, the least we can do is contribute our CSR funds to the best noble cause, and that's what we have done. We have, and we look forward for such more engagement. Thank you very much.
A very good morning to you all. Madam Karunava Keti Garu IAS, our MD, Mr. Rangaraj Garu, other dignitaries of the dais and of the dais. I'll be very, very brief. When this invitation was sent to me, I said I'm not a part of NCC, even though I'm on the CSR committee, but I'm a part of Dhaatri. I just wanted to tell you how we can propagate this program. We brought Dr. Santosh Kumar to one of our family programs. Barasale, until one of the child was born and there was a function. And then it was thought that it would be befitting if he comes and then talks about mother's milk, especially breastfeeding. And that's how the idea kindled into me, and our committee board was magnanimous enough. We have started the first funding with just 3 lakh rupees. Then when we were looking at the activities, the way it was going, we thought that we should adopt this as a strategy. Madam, you are from 𝐼𝐴 NCC has taken under CSR, under the health strategy, both Mother's Milk Bank and 𝐼𝐴 as its strategy for the health. And then I think we are supporting, we have already given a commitment for the next 3 years for these 2 programs, and we are associated with all other programs. Why I have given you the example of the family program is we have all here the future leaders and the future mothers. There is no function which you feel that you cannot involve this noble cause. Last 2 decades has seen a lot of things which were confined and considered to be very secretive and shy, like your your health pads. The day has to come that breastfeeding posters should be available at every pharmacy and every nursing home, and if possible, I come from Lions Club, we are trying to propagate this. That kind of a movement has to be taken. Recently, we went with Honorable Governor. I've also made this comment. And I was told that UNICEF is one of the organizations which can help. Now that we have Madam who is the Commissioner for Health and Family Welfare, if Telangana government can begin this with Telangana, the moment, I think this day where we have signed MOU with Women's College and starting with one of the dream projects of Dhaatri would be very, very meaningful. With this small request, Madam, thank you very much for giving this opportunity. Thank you.
Celebrity guest today. We heartily welcome Ms. Nabha Natesh to this event, popularly known as Smart Beauty. She's here to add a lot of glamour to the event. On behalf of the entire fraternity of University College for Women, we extend you a hearty welcome. I request Dr. Deepika to present a flower bouquet to Ms. Nabha Natesh. It's time for us to listen to our chief guest, Srimati Karunavaketi Garu. Ma'am, we request you to please address the gathering.
It's a great pleasure to be here. Actually, it's pretty nostalgic time for me. As a research scholar, I was actually a visiting faculty in maths and statistics for Koti Women's College. So, morning would be for research and afternoon would be for teaching the girls. I was in my early 20s, and so it's very nice to be back in the campus after a long time. I congratulate the Koti Women's College. All of us as students, the first time I was exposed to what the status of women or poverty, etc., was after I joined service. That's how much insulated the educational institutions are from what is happening in the country and development of the country. So it's very, very nice to see that young students and faculty are getting involved with actual action on the development of this country, and especially maternal health issues. So I congratulate the principal and also the faculty who had come to me and the health and nutrition department of the Koti Women's College. This is a very welcome step. Also congratulate the Sushena Foundation, Dr. Santosh, Dr. Srinivas, Kashinath Garu. We've been associated with from the health department. Dr. Santosh in many ways has been, this is my second term as commissioner. The first term, his insights into healthcare did help me to gain knowledge on various aspects, not just maternal health. He's very passionate about a whole lot of other aspects of healthcare, and that's been very, very useful to me as a professional and personally. The Nilofer Milk Bank has played a very, very critical role in not just feeding 10,000 babies as was said earlier, but has also given us a policy level insight, and I am very happy to share that the Telangana government, we have decided to set up milk banks all across the state in all the 33 districts. About 10 are currently under construction, and we are going to make it functional. I am also happy to share with you and thankful to Dr. Srinivas, President of NNF, who has agreed to help us technically in pasteurizing the milk and also to train our personnel to handle it. So by saying this in the public space, I am completely binding you, so you can't get out of this. So while we have made great strides, Telangana state law, after the state has been formed in the last 3 years, maternal mortality rate, I am very proud to say that maternal mortality rate dip has been the highest in the country. We have dropped by 17 points. So we are right behind, just behind Tamil Nadu. We are at 63, they are at 60. They have been working on public health for the last 15 years. But this very, very sharp drop has been because of the absolute commitment of our Honorable Chief Minister. We've had KCR kit, introduction of whole lot of initiatives, standardization of labor rooms, mobile vehicles for pregnant women for their ANCs, and a whole lot of labor room practices, which has ensured that the maternal mortality rate drop has been the highest. Increase in public institutional deliveries, again Telangana stands number 1 in the country. This is as per the latest SRS. However, NFHS 5 says that breastfeeding is at 37% in Telangana, so which is very, very counterintuitive, because you think the instinct of the mother is to feed the child, but somewhere something has happened and we have gone downhill. So this whole initiative of bringing out this whole concept of breast milk out in the open, talking about it, and this kind of initiatives, in my view, the milk bank is really the transformative intervention which will ensure that mother's milk and breast milk are propagated across the state and hopefully across the country. As Dr. Srinivas was saying, as we discussed today and as we've had discussions across the country somehow for various reasons, maybe C-sections, maybe the fact that mothers go out and work and whole lot of other cultural and socio-economic issues, breast milk has been one thing which has been on the decline, and if we do not address this, we will not go very far in terms of the IMR, etc. So this is going to be, in my view, one transformational intervention from the side of all of us. So in this connection, I would like to thank the corporate sector. It's only when society in all its dimensions and aspects comes together that a real firm step is taken forward. So this constructive partnership between private commitment-driven individuals and professionals that Sushena has, and educational institutions and government, we will be able to move forward in a very, very constructive manner. From my side, from the government, we are all very passionately committed to maternal health, and we were just in the tribal areas about 1 week ago, and if you actually see the situation, you wonder if there is any development that has taken place at all. You see the gutikoyas in deep forests, IMR, MMR are 3 times, 4 times what we have in the general areas. So we have a long way to go, but I think all of us together will definitely be able to achieve knowledge, commitment, compassion, and professionalism. All of us together, we should be able to make it. So I congratulate Sushena Foundation once again. I congratulate you, madam, for having this initiative in an educational institution, and I thank all of you for giving me this opportunity. Thank you.
Thank you so much for that inspirational words, ma'am. As a dedicated and committed bureaucrat, you've been doing your best, and that's an inspiration to all the young girls here today. Thank you so much. I now request Ms. Navanatesh to address the gathering here.
How are we all doing today? Let's hear some noise. Can we? I'm really, really happy to be here, to be a part of such a noble event. As we all know, as a humans, and the basic thing is when we when we're just born is the nutrition. And for various reasons, there has been deprivation in, the natural breast milk in a lot of women. And it's very easy to reach out to, bottled milk and get away with it, but it always has an long-term, effect on a baby. But this initiative, which is taken by �Sushena Health Foundation, is so appreciable. It is such a noble gesture to have bottled breast milk and to make it reach to the needy and to reach to the babies who require it, so that they have like a bright future. And I think I am really, really, really happy to be a part of such amazing, event. And also it's such an amazing, thing from the college side to make all the women and young girls aware of the importance of breast milk, so that in the future they bring the children to the country who will be strong and who will take our country, who are responsible to take our country forward. And you know that the youth are responsible to build the country stronger and take it higher. So now I was just given a couple of Telugu sentences, and I want you all to say it along with me. Talli paalu muddu, dabba paalu vaddu. One more time. Talli paalu muddu, dabba paalu vaddu. And say it to all your friends, all your who all you know, that this is been done for a cause. This is done for the growth of the country and growth of our children and the health of our children. Thank you so much.
Thank you, Ms. Nabhanatish. We are pretty sure that it will directly enter into the minds when people like you address them. Now it's time to felicitate all our guests who have taken so much of time to be with us. I request our Principal Vijayalata ma'am and Dr. Santosh garu, our Vice Principal Kavita ma'am and Dr. Srinivas Murki garu to join in felicitating our guests. I hand over the felicitation session to Mr. Kasinath garu.
Karuna Vakati garu, varu Commissioner. Wells Fargo, we are really grateful to them because they supported us for the last 4 years. This memento is presented by �Sushena Health Foundation and Neelofer Hospital to the team Wells Fargo It is a token of gratitude on behalf of thousands of mothers, neonates, and infants who had received pasteurized donor human milk and counseling. Your benevolence and support have made a difference in the lives of thousands of babies. Dhaatri Mothers Milk Bank and CLMC has been transformed into a reality because of your continuous succor and aid. Dhaatri is now a model comprehensive lactation management center for providing guidance in setting up new mothers' milk banks in Bharat. We thank Team Wells Fargo for benevolent CSR support for the past 4 years on this day, Thursday, 16th September 2021, during the program of launch of Dhaatri Mobile Mothers Milk Bank at University College for Women, Koti, Hyderabad, in collaboration with Department of Food and Nutrition, Department of Chemistry, Food Science, University College for Women, Koti, Hyderabad. Thank you very much. They are online, so they will be watching this. We really heartfelt thanks to them. Recognize the presence of some dignitaries here. Dr. Malati Shyamal garu, Director, Vemana Yoga Research Institute. So, Tarvata Vijayalakshmi Kraleti, Santosh gari, mother, because of her support. Dr. Anupama garu, �Rజనని అనే ప్రోగ్రామ్ గురించి ఆవిడ చాలా కృషి చేస్తున్నారు. డాక్టర్ బసవరాజ్ గారు ఏఎఫ్ఎంసి దుర్షవర్ హాస్పిటల్లో పనిచేస్తున్నారు. వారు కూడా నియోనాటాలజిస్ట్. డాక్టర్ తేజో ఓలేటి నియోనాటాలజిస్ట్ ఫెర్నాండెస్ హాస్పిటల్. రవికిషోర్ గారు ఇక్కడ లేరు, అక్కడికి వెళ్ళారు. డాక్టర్ చంద్రమౌళి గారు, వారు కూడా నియోనాటాలజిస్ట్, పీడియాట్రిషియన్, విజయమేరీ హాస్పిటల్. సుధామణి గారు వారు సక్షమ్ అనే వికలాంగుల కోసం పనిచేసే జాతీయ సంస్థకి స్టేట్ మహిళా ఇన్ఛార్జిగా ఉన్నారు. వారు రాఘవేంద్ర గారు, మా ఏ ప్రోగ్రాం జరిగినా ఇటు రండి, ముందు రండి, మీరు అక్కడ. రాఘవేంద్ర గారు పువ్వుల్లో దారంలాగా కనిపించకుండా ఇవన్నీ జరిగేందుకు చాలా హెల్ప్ చేస్తుంటారు. మాకు నేషనల్ లెవెల్ కమ్యూనికేషన్ కోఆర్డినేటర్ వారు. Now I request Vice Principal to give vote of thanks, then we'll move to the venue.
I deem it a great honor and privilege to propose the vote of thanks on this memorable occasion. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. First and foremost, I thank our chief guest, Srimati Karuna Vakati garu, Commissioner of Family and Health Welfare, for gracing the occasion despite of her busy schedule. My heartfelt thanks to Mr. Alluri Anantha Venkata Rangaraju garu, Managing Director, CEO Nagarjuna Constructions Limited, and we are grateful to Ms. Seema Pavarkar, CSR Head, Crompton Greaves. I thank our well-wisher, Academic Council Member, Mr. A. Durga Prasad garu, Advisor Dhaatri Mothers Milk Bank. My heartfelt thanks to Dr. Srinivas Murki, President, and Dr. Bhavani Kalvapalli garu, Vice President, Sushena Health Foundation. I thank Ms. Nabha Natesh for gracing the occasion. I am very much thankful to Dr. Santosh Kumar Karleti, Founder Director Dhaatri Mothers Milk Bank. I thank Subbaraju garu for gracing the occasion. I thank our principal, Professor M. Vijulata, for her unstinted support for the program. My heartfelt thanks to Department of Food and Nutrition and Food Science Department of Chemistry for their contribution. I thank all the distinguished guests, invitees present here. I owe special gratitude to Sushena Foundation, and I thank all non-teaching staff who have worked hard for this occasion. Special thanks to our PRO, Mr. Krishnaji Rao sir. I thank the members of the media for covering the event and all good hearts who worked behind the screen. I thank you all.
అందరూ చక్కగా అలా
అభిదిష్టమృతన్యతః అధరే సంతుషక్రమః ఇంద్రలోకః తిష్ట అపహశ్రేష్టాని సంజయన్న ఇంద్రయేన మదేతరద ధ్రువం ధ్రువేణ హవిషా తస్మై దేవాభిప్రమన్న అయం చ బ్రహ్మణస్పతి స్వం ధ్రువం దేవాభిప్రమా ధ్రువం దేవో బృహస్పతిః ధ్రువం గజన్మష్టాగ్నిరాష్ట్రం ధారయతాం ధ్రువో విద్యాబలం దైవబలం తదేవ లక్ష్మీ ఫలేత్రేగ్రేగం స్మరామి భవాయేతస్య రాజ్యమాదత్తే యో రాజాసన్ రాజో వాసో మే దయతే యశస్వాదేతాని హవేవం భవంతి ఏతావంతో వై దేవానాం సవాః తయేవాస్మై సవాన్ ప్రయచ్చన్తి దేవలక్షం గరుడం తదేవ తారావరం చంద్రవరం తదేవ
నమస్తే. ఈరోజు కోఠి విమెన్స్ కాలేజీలో ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ ఏదైతే సుషేనా హెల్త్ ఫౌండేషన్ యొక్క ప్రాజెక్ట్ ఉందో వారి చేత ధాత్రి మొబైల్ మదర్స్ మిల్క్ బ్యాంక్ అంటే ఒక చతుశ్చక్ర వాహనం అంటే ఒక వ్యాన్లో మిల్క్ బ్యాంకుని ఇనాగరేషన్ జరిగిందనమాట. దీంట్లో ఈ మిల్క్ బ్యాంక్ అంటే కనుక మదర్స్ మిల్క్ బ్యాంక్ అంటే తల్లిపాలు ఎక్కువ ఉన్న తల్లిపాలు లేని పిల్లలు ఎవరైతే ఉంటారో తల్లులు ఇవ్వలేకుండా ఉంటారు వాళ్ళకి పిల్లలకి పాలు ఇవ్వడానికి ఎక్కువ ఉన్న వాళ్ళు కలెక్ట్ చేసి తక్కువ లేని వాళ్ళకి లేదా తక్కువ ఉన్న వాళ్ళకి ఇవ్వడం జరుగుతుందన్నమాట. దీంట్లో డీప్ ఫ్రీజర్లో ఆ మిల్క్ని స్టోర్ చేయడం, తర్వాత పాశ్చరైజ్ చేయడం, దాంట్లో ఏ దోషాలు లేకుండా పరీక్షలు చేసి తర్వాత పాలు డాక్టర్ రికమెండేషన్ మీద పాలు ఇవ్వడం జరుగుతుంది. ఇది గత 4 సంవత్సరాలుగా నీలోఫర్ హాస్పిటల్లో ధాత్రి మదర్స్ మిల్క్ బ్యాంక్ నడుస్తూ ఉంది. దాని సక్సెస్ కారణంగా చిన్న చిన్న హాస్పిటల్స్లోనూ తర్వాత బయట కూడా చాలామందికి అవసరం ఉంటుంది. కాబట్టి వాళ్ళందరికీ కూడా కేటర్ చేయడం కోసం అని చెప్పి ఈ ధాత్రి మొబైల్ మదర్స్ మిల్క్ బ్యాంక్ని ప్రారంభం చేయడం జరిగింది. అంతేకాకుండా ఈ రోజున ఈ కోటి విమెన్స్ కాలేజీలో ఏదైతే న్యూట్రిషన్ ఫుడ్ అండ్ న్యూట్రిషన్ డిపార్ట్మెంట్ ఆఫ్ కెమిస్ట్రీలో ఫుడ్ సైన్స్ డిపార్ట్మెంట్ వీళ్ళతోటి కలిసి ఇంటర్న్షిప్ చేయడం కోసం తర్వాత రీసెర్చ్ చేయడం కోసం కూడా ఒక MOU సైన్ చేసుకోవడం జరిగింది.
తల్లి పాలు అనేవి నవజాత శిశువుకి చాలా చాలా ముఖ్యం. అనేక రోగాల నుంచి యాక్చువల్లీ తల్లిపాలు అనేది కాపాడుతుంది. అవి నవజాత శిశువులకి అమృతం లాంటిది. మెయిన్గా అంతకంటే ప్రీమెచ్యూర్గా పుట్టిన పిల్లలకైతే తల్లిపాలు తప్ప ఇవ్వడానికి అసలేది వీల్లేదు. కొంతమంది నవజాత శిశువులకి యాక్చువల్లీ తల్లి దూరంగా ఉండడం కారణంగా లేకపోతే వేరే ఇబ్బందులు వచ్చినందువల్ల ఇవ్వలేకపోవడం పాలు అనేవి జరుగుతుంది. అందుకు పిల్లలకి ఆ నవజాత శిశువులకి పాలు అందివ్వడానికి ధాత్రి మిల్క్ బ్యాంక్ అనేది స్థాపించబడింది. అక్కడ తల్లులు తమ తమ పిల్లలకు పాలు ఇవ్వడానికి తోడ్పడుతుంది. అలాగే ఎక్కువగా వచ్చిన పాలని ధాత్రి మిల్క్ బ్యాంక్కి డొనేట్ చేయడం ద్వారా దాన్ని స్టెరిలైజ్ చేసి తర్వాత శిశువులకు ఇవ్వడం అనేది జరుగుతుంది. అలాగా 2017 నుంచి ఇప్పటి వరకు 10,000 మంది బేబీస్కి ధాత్రి మిల్క్ బ్యాంక్ అనేది పాలు ఇవ్వడం జరిగింది. సో 10,000 మంది పిల్లల్ని కాపాడినట్టు. తర్వాత 9,000 మంది వచ్చి డొనేట్ చేశారు మదర్స్. అలాగే కాకుండా 15,000 మంది మదర్స్కి బ్రెస్ట్ ఫీడింగ్ ఇష్యూస్కి ట్రీట్మెంట్ కూడా చేయడం జరిగింది. కాబట్టి ఇటువంటి మంచి కారణానికి పనిచేస్తున్న ధాత్రి మిల్క్ బ్యాంక్ని అందరూ సపోర్ట్ చేయగలరని కోరుతున్నాము.
నమస్తే, ఐఎమ్ జయశ్రీ కుమారి from Food Science Department of Chemistry. Today we have entered into an MOU with the Dhaatri Milk Bank, and their ideology, concept, everything is novel. There is a lot of scope for the students to become a good citizens with a inculcated social responsibility, and scope for the research and internships. And I appreciate Dr. Santosh Kumar Garu on this occasion for taking an initiative in the noble cause, and I welcome to work with us. And then with this mutual agreement, I wish that Women's College Koti and Dhaatri Foundation, Sushena Health Foundation will be achieving good heights, and then strive hard to work for the community development. Thank you all.
I am Dr. Basvaraj. I am a pediatrician and a newborn specialist. The noble cause what we are working for is women breast milk banking. In this, the new one which was added to it is the mobile mother's mobile milk banking. The main advantages of this is the many small units where the mothers cannot travel, or the unit themselves can't be having the full-fledged breast milk bank. In such institutes, it's going to help. This mobile can go there, reach there, collect the milk, pasteurize and bring back. So by this way, many of the small units which are there, those things can be covered by this. So it's a very good initiative. So as need arises, more such units can be added. That is what is the plan. To start with the few units and then move ahead with the more units.
ఇప్పటికే మనందరికీ తెలుసు తల్లిపాలల్లో రోగనిరోధక శక్తి చాలా ఉంటుంది. ఈ కొత్తగా పుట్టిన శిశువులు ఎవరికైతే ఈ తల్లిపాలు లభించట్లేదో అలాంటి వాళ్లకు ఇది ఒక మంచి ఇనిషియేటివ్ అని చెప్పొచ్చు. ఇప్పుడు తల్లులందరూ వచ్చి నీలోఫర్ హాస్పిటల్లో ఎవరైతే పాలు ఇవ్వలేరో అలాంటి వాళ్ళ కోసము ఈ వ్యాన్ అనేది వాళ్ళ దగ్గరికి ఏ ప్రాంతాలలో వేరే ప్రాంతాల్లో ఉన్న తల్లుల దగ్గరికి ఈ వ్యాన్ వెళ్ళి వాళ్ళ దగ్గర నుంచి ఏదైతే ఎక్కువ పాలు వస్తుందో దాన్ని కలెక్ట్ చేసుకొని ఎవరికైతే నెసెసిటీ ఉందో అవసరమైన చిన్నారులకు అప్పుడే పుట్టిన పిల్లలకి, ఎందుకంటే ఈ డైజెస్టివ్ సిస్టము డబ్బా పాలని అందరి పిల్లలకు పడవు. అలాంటి వాళ్లకు ఈ తల్లిపాలు ఇవ్వడం అనేది ఇది చాలా మంచి ఉద్దేశము అండ్ మంచి కారణము. ఇలాంటివి అన్ని దేశాల్లో కూడా ఉన్నాయి. మన సౌత్ ఇండియాలో ఈ మొబైల్ వ్యాను అనేది ఇది మొదటిసారి వీళ్ళు ధాత్రి ఫౌండేషన్ వాళ్ళు, సుషేనా ఫౌండేషన్ వాళ్ళు ధాత్రి అనే ఇనిషియేటివ్ తీసుకొని చేశారు. అండ్ దానికి మా కాలేజీ మేము కూడా వాళ్ళతోటి MOU చేసుకొని మా కాలేజీ కూడా ఇందులో పాల్గొనడం మేము చాలా మాకు అడ్వాంటేజ్ లాగా భావిస్తున్నాము. అండ్ మా ఈ అందరి యంగ్ గర్ల్స్కి వాళ్లకు తల్లిపాల ఆవశ్యకత కూడా దీని గురించి ఇట్లాంటి ప్రోగ్రామ్స్ చేయడం వల్ల తెలుస్తుంది. అండ్ తల్లిపాలే ముద్దు అనేది మన పిల్లలకు కూడా తెలుస్తుంది.
ఉమెన్ కోటి మేము చాలా ఆనందపడుతున్నాం ఈ ప్రోగ్రామ్ ఇక్కడ జరిగినందుకు. వీ హ్యావ్ ఫెసిలిటేటెడ్ దిస్ ప్రోగ్రామ్ ఫర్ ధాత్రి ఫౌండేషన్ అండ్ ది అదర్స్. ఈ ప్రోగ్రామ్ వల్ల మా స్టూడెంట్స్కి చాలా బాగా బెనిఫిట్ అవుతుంది, ఎందుకంటే దే ఆర్ వుడ్ బి మదర్స్ అండ్ వాళ్ళకి దీని ఇంపార్టెన్స్ బాగా తెలుస్తుంది. ఒక్కసారి ఇది ఇంపార్టెన్స్ తెలిస్తే అండ్ హౌ దిస్ ఇస్ గోయింగ్ టు హెల్ప్ ఫ్యూచర్ జనరేషన్స్ అండ్ బిల్డింగ్ అవర్ నేషన్ బిల్డింగ్ ఒక స్టెప్పింగ్ స్టోన్ లాగా పనిచేస్తుందని నా ఉద్దేశం. ఇట్లాంటి కార్యక్రమాలు ఇంకా జరగాల, ఇంకా చాలా వ్యాన్స్ మనకు రావాలా, సో దట్ మన పిల్లలు ఏదైతే ఇమ్యూనిటీ కోల్పోతున్నారో అది కోల్పోకుండా మంచి సిటిజన్స్ లాగా మనకు పనికొస్తారండి. థ్యాంక్ యూ.
తల్లిపాల ఆవశ్యకత గురించి మనము ఎక్కువగా మాట్లాడుకోవాల్సిన అవసరం లేదు, మనకు అందరికీ తెలుసు అవి చాలా ముఖ్యము. దానివలన అన్ని శిశువులకు చాలా రకమైన ఉపయోగాలు సమకూర్చుతాయి. సో ఈ ఉద్దేశంతోనే ధాత్రి మిల్క్ బ్యాంక్ అనేది సుషేనా ఫౌండేషన్ ద్వారా నీలోఫర్ హాస్పిటల్లో మనం మొదటగా స్టార్ట్ చేశాము. దీని వలన చాలా శిశువులు ఎవరికైతే ఆరోగ్యం సరిగా లేదో వాళ్ళకి ఆరోగ్యం సరిగా లేకుండా వాళ్ళ తల్లులకి తల్లిపాలు రాని వాళ్ళకి మనం హెల్ప్ చేయగలిగాము. ఇప్పటి వరకు దాదాపుగా 10,000 మంది శిశువులకు మనము ఈ తల్లిపాలని ప్రొవైడ్ చేయగలిగాము. చాలామందికి ఇది ఉపయోగపడింది కూడా. ఇదే కాకుండా ఆ మిల్క్ బ్యాంక్ ద్వారా మనము కంగారు మదర్ కేర్ని, ఫ్యామిలీ సెంటర్డ్ కేర్ని ఆ NICUలో మనం ప్రమోట్ చేయగలిగాం. సో ఇప్పుడు ఈరోజు మనము ధాత్రి మొబైల్ మదర్స్ మిల్క్ బ్యాంక్ అనేది స్టార్ట్ చేస్తున్నాము. దీని వలన ఈ ఉపయోగాలు ఏవైతే మనము నీలోఫర్ హాస్పిటల్లో మనం చేయగలిగినామో ఈ మొబైల్ వ్యాన్ అవైలబిలిటీ వల్ల మనం ఇంకా చాలామంది శిశువులకి హైదరాబాద్ బయట ఉన్న తెలంగాణ స్టేట్లోనూ ఉన్న చాలామంది పిల్లలకి ఇది ఉపయోగపడుతుంది. ఎందుకంటే ఈ మిల్క్ బ్యాంక్ వ్యాన్ ద్వారా మనము వెళ్ళి అక్కడ మిల్క్ కలెక్ట్ చేసి అక్కడ తల్లుల్ని ఎడ్యుకేట్ చేసి అక్కడ తల్లులు ఎవరైతే మనకి ఈ తల్లిపాలు దానం చేస్తారో ఆ తల్లిపాలు తీసుకొని వచ్చి మనం ఈ బ్యాంక్ దగ్గర పాస్చరైజేషన్ చేసుకొని మళ్ళీ అవసరమైన శిశువులకి ఇది సప్లై చేయడం ద్వారా చాలా శిశువులకు మనం ఉపయోగపడుతుంది. ఇంతకుముందు చెప్పిన విధంగా చాలా గణాంకాలు యూనిసెఫ్ ద్వారా కానీ గవర్నమెంట్ ద్వారా కానీ మీరు చూడగలిగినట్లయితే తల్లిపాల వల్ల కనీసము 10 నుంచి 20% శిశు మరణాన్ని మనము తగ్గించవచ్చు.
ఈరోజు చాలా శుభదినం. ధాత్రి మిల్క్ బ్యాంక్ వాళ్ళు మన మొబైల్ వ్యాన్ ఇవాళ ప్రారంభోత్సవం జరిగింది. అలాగే ఉమెన్స్ కాలేజ్ తోటి MOU కూడా జరిగింది. ఇది చాలా రోజుల నుంచి పెండింగ్ ఉన్న ఐటమ్స్ చిరకాల వాంఛ, ఈరోజు అది తీరింది. దీంతో చాలామంది పిల్లలకి తల్లిపాలు లేని పిల్లలందరికీ ఇది బాగా ఉపయోగపడుతుంది. అన్నిటికన్నా ముఖ్యం పిల్లలకి తల్లిపాలు. మొదట్లో తల్లిపాలు తాగిన పిల్లాడికి ఉన్నంత ఇమ్యూనిటీ డబ్బా పాలతో రాదు. అదే ఉద్దేశంతో ధాత్రి మిల్క్ వాళ్ళు చేస్తున్న ఈ మహత్తర యజ్ఞానికి ఈరోజు మరొకసారి ఇంకొక నాంది పలికింది. అదేంటంటే మొబైల్ మిల్క్ వ్యాన్. దీంట్లో ఎక్కడైనా తల్లులు పాలు ఇవ్వడానికి రెడీగా ఉంటే డోనర్సు, ఈ వ్యాన్ అక్కడికే వెళ్ళి వాళ్ళ దగ్గర నుంచి పాలు తీసుకుని కావాల్సిన పిల్లవాళ్ళకి అది స్టోర్ చేసి మళ్ళీ వాళ్ళకి అందించడం చేస్తుంది. ఇది మహత్తర కార్యం. అలాగే ఇంకొక మైల్ స్టోన్ ఏంటంటే విమెన్స్ కాలేజ్ తోటి ఈ రోజున MOU చేయడం జరిగింది. దీని మూలంగా విమెన్స్ కాలేజ్లో 4000 మంది పిల్లలు చదువుతారు. వీళ్ళందరి మూలంగా కూడా ఇది తల్లిపాల యొక్క ప్రాముఖ్యత, పబ్లిసిటీ అది చాలా బాగా జరుగుతుందని మేము బాగా ఆశిస్తున్నాం.
ఈ ధాత్రి వాళ్ళు చేసిన ఈ ప్రోగ్రాము ఇట్స్ అ వెరీ నోబుల్ కాజ్ అండి. తల్లిపాలు అనేది ఇట్ ఈస్ సపోజ్ టు బి ద మోస్ట్ సేక్రెడ్ అండ్ ద ప్యూరెస్ట్ ఫార్మ్ ఆఫ్ మిల్క్, అండ్ ఐ ఫీల్ దే డిజర్వ్ ఎవ్రీ కైండ్ ఆఫ్ అప్లోజ్, అండ్ what they have done today is to set a benchmark in women's health and mother's health. ఇలాంటివి ఇంకా చేయాలని, ఇలాంటివి ప్రోగ్రామ్స్ త్రూఅవుట్ ది స్టేట్, త్రూఅవుట్ ది నేషన్ చేయాలని మనస్ఫూర్తిగా కోరుకుంటున్నాను. అండ్ ఐఎమ్ రియలీ వెరీ హ్యాపీ టు హోస్ట్ దిస్ ప్రోగ్రామ్ ఇన్ అవర్ కాలేజ్, దట్ ఈస్ యూనివర్సిటీ కాలేజ్ ఫర్ ఉమెన్, అండ్ ఇట్ ఈస్ అ వెరీ ప్రెస్టీజియస్ వన్ ఫర్ us, and we will make sure that we will associate with Dhaatri more often, and we'll do more prestigious programs like this.
मेरा नाम शरद दिनेश कुमार, मैं दिल्ली से आया हूँ, हैदराबाद। ये गाड़ी जो है हमारी गाड़ी है, हमारी कंपनी गाड़ी है, नोएडा विजुअल टेक्नोलॉजी इंडिया प्राइवेट लिमिटेड.
నేను ధారా శర్మ. I work for Sushena Health Foundation, and it has been my pleasure to work in Dhaatri Sushena, and now with this project we have been serving lot of mothers and babies, preterm babies, and I am really happy that I am a part of this total project, and now we have inaugurated this mobile milk bank through which we are planning to move into communities and serve more mothers and children. And I thank everybody who has been associated with Dhaatri Sushena, all our donors, donor mothers, supporters, because we all have it's a combination. We have to move together. It's not that only one person can take up everything, and I thank all of them, and I look forward to all of your support. Thank you.
क्रॉम्पटन की तरफ से, क्रॉम्पटन की पूरी CSR टीम की तरफ से मैं कहना चाहूँगी धात्री मिल्क बैंक और सुशेषना फाउंडेशन जो काम कर रही है वो काफ़ी बहुत अच्छा काम है, और ये मुझे धन्यवाद कहना चाहिए कि हमको ये अपॉर्चुनिटी दी कि CSR के थ्रू हम लोग ये प्रोजेक्ट हम लोग फंड कर सकें, और ऐसे और भी प्रोजेक्ट्स हम लोग सोच रहे करने के लिए, एंड आई लुक फॉरवर्ड टू एक्सपैंड दिस प्रोजेक्ट. थैंक यू.
सुशेना हेल्थ फाउंडेशन, ఉమెన్స్ కాలేజ్ కోటి, డిపార్ట్మెంట్ ఆఫ్ న్యూట్రిషన్ అండ్ ఫుడ్ సైన్స్ వాళ్ళతో ఈరోజు కొలాబరేషన్లో ధాత్రి మొబైల్ మిల్క్ బ్యాంక్ ఇనాగ్రల్ జరిగింది. పిల్లలు శిశువులకు కావాల్సిన అంటే తల్లులు ఎవరైతే మిల్క్ డొనేట్ చేయాలనుకున్నారో మారుమూల ప్రాంతాల నుండి రీచ్ కాలేకపోతున్నారన్న వారి ఉద్దేశాన్ని గౌరవిస్తూ వీళ్ళు సుషేనా హెల్త్ ఫౌండేషన్ వారి దగ్గరికే వ్యాన్లో వెళ్ళి పాలు సేకరించి అవసరమైన శిశువులకు అందించడానికి తీసుకున్న ఈ యొక్క ఉద్దేశాన్ని ముందుకు నడిపించడానికి ఉమెన్స్ కాలేజ్, డిపార్ట్మెంట్ ఆఫ్ న్యూట్రిషన్, ఫుడ్ సైన్స్ కలిసి వచ్చి ఈరోజు విజయవంతంగా ఇనాగ్రల్ ఫంక్షన్ని జరిపించారు. దీనికి సహకరించిన ప్రిన్సిపల్ గారికి, సుషేనా హెల్త్ ఫౌండేషన్ గారికి, అందరికీ డిపార్ట్మెంట్ ఆఫ్ న్యూట్రిషన్ తరఫున హెడ్గా నా ధన్యవాదాలు తెలియజేస్తున్నాను.